Have you ever heard that frequent ejaculation could actually help prevent prostate cancer? It sounds like one of those internet myths, but there's real research behind it. Let's talk about what the science really says and what it means for your health. I'm Dr. Carolina, a urologist who helps men understand their bodies and take charge of their health. This is one of those topics most men are curious about but rarely discuss, so let's do it the right way, openly and with facts. Most men don't think about their prostate until it starts causing problems. Weak urine flow, waking up at night to pee, or that constant feeling the bladder never quite empties. It's uncomfortable to talk about, I get that. But pretending it isn't there doesn't protect you. Understanding it does. The prostate is a small, walnut-sized gland just below the bladder. Its main job is to produce the fluid that nourishes and carries sperm. After about age 40, it naturally starts to grow, a process called benign prostatic hyperplasia. It's not cancer, but it can lead to those frustrating urinary symptoms many men experience. Now, here's the question that gets people's attention. Does ejaculation frequency affect your prostate's health? According to a major Harvard study published in European Urology in 2016, researchers followed about 32,000 men for 18 years. They found that men who ejaculated more than 20 times per month, roughly 5 times a week, had about a 20% lower risk of developing prostate cancer compared with men who ejaculated only 4 to 7 times monthly. The benefit was seen both in men in their 20s and again in their 40s. An earlier Harvard paper from 2004 in JAMA showed the same direction. Higher lifetime ejaculation frequency was linked with lower risk of prostate cancer, especially for localized, low-risk disease. Scientists think the reason might be what's called the prostate flushing hypothesis. Each ejaculation clears old prostatic fluid, inflammatory debris, and possible carcinogens that could otherwise accumulate. It's like flushing the pipes so they stay clear. But keep in mind, this is correlation, not proof of cause and effect. Men who ejaculate more often might simply live healthier lives. They may exercise more, eat better, or have lower stress, and those habits reduce cancer risk too. Some smaller studies have shown no effect, and a few even the opposite. Most importantly, frequent ejaculation doesn't seem to protect against the most aggressive, fast-spreading forms of prostate cancer, so we shouldn't oversell it. And here's a practical note. Ejaculation can temporarily raise PSA levels, the blood test used to screen for prostate issues. If you have a PSA test scheduled, avoid ejaculation for 48 hours beforehand so the reading is accurate. So, yes, regular ejaculation might support prostate health, but it's not a magic bullet. The prostate depends on hormones, diet, exercise, and overall inflammation in the body. After 40, testosterone levels slowly decline while DHT, a stronger version of testosterone, rises. High DHT encourages prostate growth. Staying active and maintaining a healthy weight help balance those hormones naturally. What you eat matters too. Diets rich in vegetables, berries, whole grains, and healthy fats like olive oil or fish are linked to lower inflammation. Cooked tomatoes contain lycopene, which may offer mild protection, but think of it as part of a good diet, not a cure. Supplements like saw palmetto are popular, but most large studies and Cochrane reviews show little or no real benefit for urinary symptoms, so use them only if your doctor agrees. Here's what I tell my patients. Talk to your doctor about prostate cancer screening around age 45 to 55. Earlier if you have family history or are at higher risk. Don't ejaculate for 2 days before your PSA test. Move your body every day. Even a brisk half-hour walk helps circulation and hormone balance. Eat an anti-inflammatory diet and limit processed foods, sugar, and excess red meat. And yes, it's perfectly healthy to ejaculate regularly, whether through sex or masturbation. The large Harvard studies suggest about 20 times a month is associated with lower risk, but the right frequency is whatever feels natural and comfortable for you. Finally, don't ignore warning signs. Weak stream, hesitancy, or frequent night urination all deserve attention. The earlier we check, the easier it is to manage. Your prostate is small, but it has a huge impact on your confidence, your energy, and your long-term health. Taking care of it isn't embarrassing, it's responsible. So talk openly with your doctor, take care of your body, and don't let myths or shame control your health decisions. I'm Dr. Carolina. If this information helped you, share it with someone who needs the facts, not the fear. Because your health is your power, and you're worth protecting.